Konnichiwa. I'm so honored to be here today to present our outcomes on campus-based HIV self-testing in Taiwan. I'm An-Chiao Liu, and an assistant researcher at Taiwan CDC. And to begin, I'd like to share some key information about Taiwan. We have a population of approximately 23 million people, and GDP per capita is around 34,000 US dollars. Taiwan has a robust healthcare system supported by our National Health Insurance Program, which provides coverage to all citizens and long-term residents. Under Taiwanese law, and the government is required to cover HIV healthcare costs for people living with HIV. As part of our effort, now there are 92 HIV designated hospitals and clinics, and 124 HIV designated pharmacies to provide to dispenses and antiretroviral medication based on doctors' prescription. Currently, Taiwan has around 45,000 people diagnosed with HIV, of whom and over 36,000 are living with HIV. Over the past decade, HIV transmission among MSM group has been the predominant route of infection. Additionally, the majority of the new cases occurred in individuals under the age of 34. As part of our ongoing efforts to meet the UNAIDS 95 targets by 2030, Taiwan has made significant progress. In 2024, we achieved a 92, 96, 95 outcome. This represents a remarkable improvement compared to 2015, demonstrating the substantial progress we have made in HIV prevention and treatment. Now, I'd like to introduce our policy on HIV self-testing. In 2016, we launched our HIV self-testing program. However, implementing it was not easy. Due to legal restriction, HIV self-testing couldn't be sold freely. In response, our team took the lead in promoting HIV self-testing through LGBT plus community, HIV-designated hospitals, and pharmacies. To reach more key population, we installed HIV self-testing vending machine in gay sauna and LGBT-friendly stores. Additionally, considering Taiwan has one of the highest designations of convenience stores in the world, we collaborated with major convenience stores chains. Through this partner, people can order self-test kits online and pick them up at convenience stores. The entire process takes only 1 to 2 working days, making it very convenient. In our promotion efforts, the self-testing programs has become well known within the LGBT plus community. However, we observed a concerning trend. A growing number of newly diagnosed HIV cases are among the younger generation. In fact, around 65% of new HIV cases are currently under the age of 34. In response to this trend, we launched a campus-based program to reduce financial barriers to increase accessibility of HIV self-test kits for students. Although the kits are already quite affordable, we believe that further reducing the cost burden of students can significantly increase testing uptake. In this slide, I also include information on related policies, such as offering HIV self-test kits alongside Mpox vaccination, and cooperating with NGOs to distribute kits to sex workers. We hope to share more about this experience in the future. As for the campus-based program, here is the outcome of HIV self-testing program in Taiwan. And as the campus-based program, here's how it works. Students have to register on our website using their school email for verification. And this is the registered website. And they need to, we don't collect any personal data beyond the school email, which is only used to confirm the student's status. Once verified, students receive a voucher that can be redeemed online to order kits and pick them up at convenience store or use at physical community service sites. To better under user experience and encourage participation, we also organized 6 campus-based HIV self-testing promotional campaigns last year. Students who participated received a gift card, a small amulet, and free self-test kit, and even a chance to receive a fortune-telling reading. And these creative elements help integrate HIV prevention education in a more engaging and culturally relevant way. Since the launch of HIV self-testing program, we have included a service QR code on the self-testing kits to collect user feedback. Participation in this service is voluntary. We analyzed the data from both individuals who participated in the campus-based program and those who obtained test kits through other channels. Since the program launched up to the end of the 2024, a total of 5,937 test kits has been requested, with 4,245 successfully redeemed. Additionally, 471 individuals complete a basic demographic questionnaire. Compared to individuals who access self-test kits through other channels, participants in the campus-based program exhibit distinct demographic characteristics: a higher proportion of female, a higher proportion of self-identified bisexual individuals, a lower average age, and a higher proportion residing in eastern region of Taiwan. A behavior questionnaire was completed by 1,249 individuals, revealing notable differences in tasting behaviors. Compared to other distribution channels, campus-based participants were more likely to be first testers. They were less likely to have engaged in sexual activity in the past. However, they have a higher proportion of regular sexual partners transmitted infection in the past year. And about the self-report initial positive results, condom usage during intercourse and other risk behavior, such as alcohol or substance use, didn't show significant difference between groups. So why should we continue promoting campus-based programs? We believe that through the free policy, the younger generation will gain knowledge about HIV prevention. Even if they haven't engaged in high-risk sexual behavior, when they do in the future, they will remember the available testing channels. Our goal is not only to reduce the rate of new diagnoses, but also to improve sexual education, reduce the stigma about the HIV. As part of our campus-based program, we create stickers to raise awareness. These stickers will distribute to high schools and universities across Taiwan. Encourage schools to post them in public restrooms. The idea is simple. When you pee and you can see it. And thank you for your attention.